All right, y'all, so Residency Reflection. I can't remember what week it is right now, but last week was great. I mean, I got to have a patient who had functional neurologic disorder, at least suspected functional neurologic disorder, who also had a chronic spinal cord injury, so that was kind of a unique case, a lot of interdisciplinary work, talking with the psychologist, with OT, kind of making sure we were all on the same page and kind of treatment plan. And then got to discharge my patient with Guillain-Barré. They kind of reached their plateau stage when they were working with us, but we were able to get them walking again, or I should say walking again functionally. So they were able to take a few steps at the acute hospital, but here we were able to get them taking, community distance steps. We were able to work on some balance things and transfers a lot more, which was good. And kind of just set some good expectations for what this patient can expect to see as they progress through rehab, and kind of figure out what equipment they would need and things like that. So that was a really cool experience. I did get a new patient on my caseload starting last week. Did their eval. They are a subacute to chronic spinal cord injury, and they never actually went to acute rehab, which is kind of an interesting case because most patients with spinal cord injury definitely go to an acute rehab facility. So they kind of learned a lot of things on their own through the internet, through YouTube, watching videos of other people with spinal cord injuries transferring and things like that. So it's kind of a unique case in the sense that they still have a ton to learn, but they've been kind of managing this and dealing with this for a while, so they've already learned a few things. Thankfully, they're not like super in the chronic stage. They're only, 7 months out, 6-7 months out. So kind of passing that subacute phase, starting to get into that more chronic phase. But they're very motivated to learn and kind of see what they can gain from inpatient rehab. So that's kind of a unique case. And then last week we were also able to start kind of some co-treatment sessions with our residency director, Dr. Ryerson. So she pretty much will treat one of our patients with us. They get a total separate treatment session, and we kind of work on what she wants to work on. She kind of leads the session. Because of COVID, we have to kind of do the hands-on stuff through listening to her, because it's kind of for her to explain her clinical reasoning and thought processes and things, which is really cool to get to kind of really take a bunch of time with a patient and listen to somebody that's an expert in treating them. So we started those last week. We get to do it again this week, and also got to start learning about the course we're going to be teaching in the summer. So I'm going to be kind of heading the motor control lecture, which is going to be a ton of fun. I'm super interested in motor control. However, it is going to be all on Zoom, which is going to prove to be a challenge. It's the first lecture of the semester, so I've got to set a good precedent, and it's going to be my first complete lecture, 90 minutes on Zoom. So that's going to be challenging and hopefully a good learning experience for me and for the students, but should be a good time. Sorry about that. So kind of looking forward to this next week coming up, and excited to keep seeing what residency brings. Excited to start getting a little bit more into the research project. I have a few meetings this upcoming week with it, and get to start working on this presentation for the motor control lecture. So that's this week's Residency Reflection. Thanks for watching.